All right. So should we just start off with introductions?
Sure, go ahead.
Okay. So first of all, this is our first episode. Are you so excited?
So excited.
Woo! First episode. Sorry, I have dirty tissue in my hand.
I know.
First episode of what are we calling this?
Uh,
Cancer combos with Crush. That's
Cancer
me
combos with and coconuts.
and coconuts. So I'm Crush, and I have triple negative metastatic breast cancer. And you are?
I am coconuts, and I have an infiltrating astrocytoma glioma brain tumor.
Easy, easy peasy. All right, so what are we talking about today?
Today we are talking about scans.
Scans. Hashtag
Scans.
Scanxiety.
I've never done that. Hashtag.
Hashtag
Dude, it's a number sign. It's a number sign.
number sign Scanxiety.
It's a hashtag.
PET scans are my favorite scans just because I take a Valium and I sit in a dark room and they cover me in blankets and I just, fall asleep. And then they put me in a giant machine and then it's over. There's a lot of radioactivity, I think. I think it makes you radioactive for a little while, but, besides that, it's pretty fun.
Yeah.
Do you have a favorite kind of scan or they just all suck?
Yeah. So brain cancer, you pretty much do an MRI of the brain with contrast, and they're not too bad. They're really loud. But it's the contrast dye. Like the first time it didn't bother me, but it can cause me to induce me into seizures. So that's the scariest part for me is that but kind of like your Valium, I take a lorazepam just to calm myself down, and it keeps my brain waves a little bit calmer. Um, but I don't know about you. The worst part of the scan for me is just the anxiety. Like just they're scanning your body for you, or for me, it's just my brain, and I'm sitting there thinking like, what are the techs looking at?
Yeah.
And when you walk out of that room, you're like, is it gonna be like, oh, they're looking at me weird. Does that mean they saw something?
Yeah, exactly. Yeah, no, scans. I mean, the anxiety is definitely the worst part of the scan. I can handle getting poked and shoved in machines and all that stuff, but just like waiting for the results afterwards is the worst.
So if your PET scan is your favorite, what's your least favorite?
So I think my least favorite was probably the one mammogram that I've ever had, which is the benefit of having a double mastectomy is that I never have to have one of those ever again.
The one benefit?
Yeah, the one benefit. They'll always be perky, and I never have to have another mammogram. Because I had a mammogram when I was 30, and 30-year-old boobs are not meant for mammogram machines. It's just squished and it's just awful, and it was the most painful. I mean, I had bruises, like it was ugly. MRIs are a little stressful because they're just so noisy, but I think after my second or third one, I just started pretending like I was in some weird like European discotheque or something.
Totally. Totally. I learned also that you have to, because you pick the music. I don't know about you, but like, they asked me what music do you want, or what kind of music, and I think I got something stupid, like, oh, you know what? I just want to be chill today. I don't know, something soft, and it was all these sad songs. I'm in there trying not to cry, just like, oh God, I'm gonna totally die. This would be so awful. So now I pick like Britney Spears, like anything that I'm gonna be like, this is just. You can't be sad when you're listening to something like goofy. No offense, Brittany.
Love Brittany. My least favorite part about the CT scans are when you get the contrast, it makes you feel like you've just peed yourself.
That's interesting.
It's really weird. Yeah, it's just like warm sensation. It's not. My favorite part though is the text and all of their like euphemisms for like what it feels like to pee all over yourself. It's like it's gonna be like a thing down in that area, right? Yeah, I know. I've done this before. So, are scans accurate? This is like the thing that causes all the anxiety, right? Is like what
Well,
what are we gonna find out? It feels like it feels like scans are so like they're just showing they're just like opening up your body and showing exactly what's inside your body. But that has not been my experience with scans. What about you?
no, not at all. I think that's the biggest misnomer with scans is that they get treated and doctors tend to treat the patient like scans are fact.
Yeah.
And they are absolutely not fact.
Yeah.
And that's why you can get, I've had this happen 3 times already, I think, that doctors have, well, two for sure. Two times I've had doctors recommend radiation. These are two different hospitals within a couple different years of difference. And they both were pushing radiation in clinical trials, and they were telling me that my tumor was growing, and I was terrified. So we ended up finding an independent facility that doesn't administer any treatments. So all they do is the like an imaging analysis of your scans.
Mm-hmm.
And when I've sent the information to this location, both times they sent the most comprehensive report of my brain ever. And they not only has the tumor not been growing, in one instance, it actually had shrunk a little bit. The problem is that these scans,
So crazy.
Number one, like for me with my scans, like one MRI will have like 1,500 slices of my brain. And then 3 months later, it'll be 500. And there's no standard comparison. And it's really subjective. And they have to kind of like fiddle with the light on them. And so the point is, you can't, if you are nervous or if you just want to double check, go to get a second opinion from a facility that does not provide treatment, because they have no bias. They've got no,
no incentive to.
No incentive.
Yeah. Yeah. I've had scans that showed I've had like basically false positives and false negatives. So, when I was first diagnosed, I had chemo. I had 12 weeks of chemo, and I was on an experimental drug, so I was getting an MRI like every month, I guess. And so the first MRI showed it was, its original size was like 4.5 centimeters, and then the second MRI showed that it was like 3.5 centimeters or something. So it was like pretty significant shrinking. And then the third MRI showed that it was 4.5 centimeters again. And it was, they told me in like the worst way possible. Like it was some doctor who I'd never met before, like just like blurted out like, well, your tumor is not shrinking. So, and I was like, wait, what? It was like devastating. Because it meant the chemo wasn't working. And so I talked to my doctor, and this is what she said. Like, my doctor was like this very strict German woman, and she just like didn't have the best bedside manner. And this is when I was like, super upset. And she said, your fear is a symptom of the MRI. And I was like, what? Makes no sense. It was the worst. But
I'm
she was
still trying to
trying to
figure it
say that
out.
like most people don't get so many MRIs, and I was getting a lot, but basically the more MRIs you have, the more likely there is to be some kind of mistake. And so like that middle one, basically, she said, yeah, you take like the MRI takes like slices of the tumor. So like if you have an apple and you take a slice, from this side, then it's going to look a lot smaller than if you take a slice from the middle. And she's like, basically, we probably like measured the wrong slice and the one that looked like it was shrinking. So that's happened to me before. And then I've also had I had a PET scan that showed a bunch of it showed cancer in one lymph node that we knew had cancer in it because it had a biopsy. But then it showed cancer, or it lit up. Two other lymph nodes lit up in my chest, and those on the next PET scan were just totally gone, and I hadn't even really had that much treatment or anything in the interim. So, and I had several oncologists tell me that those lymph nodes in your chest can light up very easily if there's like if you're having a cold or like fighting something off, like so. PET scans are problematic because they just show inflammation, really, and cancer is some serious inflammation. But like, yeah, if you're sick or injured, like that's why you have to sit perfectly still for a PET scan. Before you get the PET scan, right after you get the radioactive glucose, because if you like, if you like bump your arm, it'll show up as inflamed there. So you can really easily get false positives on PET scans. So
Yeah.
I totally agree that you kind of have to like you just have to know your body and you just have to pay attention.
And if a doctor is pushing a treatment on you, you want to make sure it's necessary, because
Yeah.
twice now I could have been unnecessarily, my brain radiated. Like,
Yeah.
that's crazy to me. And the problem with an MRI is that when you get that scan, it basically is just showing you inflammation, scar tissue, tumor. Like, I think those are the main three, and they often can't tell what's what. And so
Yeah.
what they do is they compare, and it takes a series of scans to see if something's growing or changing. So
Right.
that's not a very precise way to do it, because even scar tissue can grow, or you
Yeah.
can, if you have radiation, 6 months to even a year or year and a half later, you can have more further necrosis, which is the dead tissue, and it looks like it's growing, but it's not. It's scar tissue, or holes in it, and I don't know. It's
Yeah.
complicated. So you really want to make sure before you opt for any kind of aggressive treatment that you're as sure as you possibly can, and that's why you pick independent facilities
Yeah. So
to verify.
how did you find the independent facility you use?
My parents, they were watching me get better and better and better, and it wasn't adding up. They didn't believe that the tumor was back. So
Good for them.
um, the,
So they just researched and found.
yeah, they found an independent facility, and it's in Texas, and you
Yeah.
just send all of your documents over there, and I'm sure there's more than that one, but
Yeah. That's
and
awesome.
we can post that down below. I'm sure they won't mind that.
Yeah. And do you have to pay for that out of pocket then?
Yes. If you have an insurance that does out of network or something
Mm-hmm.
like that, your insurance might pay for part of it.
Yeah.
Um, but I mean, gosh, it's like the best money we've spent. I
Yeah.
mean,
It's worth it.
you can't put a price on that.
Yeah.
Although you can put a price on it in several $100s. But
Yeah. Yeah. No, totally. The other thing I think I've learned is that like one tech to the next can sometimes say totally different things. So even just like sending, like I'm affiliated with a couple different hospitals, like, just having different techs at different hospitals sort of review what other techs have looked at, um,
yeah.
can also be helpful, even if it is a treatment facility. But yeah, definitely getting that independent opinion I think is super important. It's just I feel like there's so much anxiety wrapped up in getting scans that it's so hard to, when your doctor tells you like, this is, we found more cancer, we found, it looks like it's growing. It's so hard to like be in your right mind and say like, well, I'm gonna get a second opinion because it feels so much like fact, but it's just not. It's just much more of an art than it is an actual science. So
It's the main points about scans, that they're not fact.
scans are not always right. So figure out from your doctor how long it should take, and try to hold them to it. I mean, it really shouldn't take more than a day or so to get results.
Mm-hmm.
So try to hold them to that. Call and pester them if you can. If you can get direct access to the records department, do that. But don't feel like you have to sit around and wait days or weeks for results because that's just crazy. Biopsies are obviously the one thing that, like, that kind of thing takes time because it's going through a lab and everything. But any
Right.
imaging scans should take just a couple days. So, and demand answers when you're reading the results. Like, get second opinions if you need to on the scans themselves. Um,
From an independent facility.
Independent facility that does not provide any kind of treatment because they have no incentive to give you brain radiation or whatever.
I mean, whether you're paying with your insurance, whether you're paying out of pocket, doctors are working for you, period. So you deserve respect. You deserve to be treated like almost a peer, you know?
Yeah. So, yeah, it's cool. First episode.
Boom.
Talking about scans.
Yeah. Okay. Scans. Oh. Hi, Dad.